What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Hey, I'm Will Tuft, and this is the Beyond the Scripts Pharmacy Podcast. And today we have a special guest, Blair Thielemier, who's going to help talk through some of those very familiar challenges for every pharmacy out there, I think. And really what I wanted to talk to Blair about is that struggle to convey the pharmacist value on both sides of the coin to the patient and to the providers, and really make those connections that are going to move their business forward. So Blair, welcome to the program. And you're from the Pharmapreneur Academy?
Yes, thank you so much for having me. I've been working as an MTM consultant pharmacist for the past 6 years, and I've seen so much change happen. And I know Pioneer has really been at the forefront of making sure that pharmacists have the software and everything that they need to be able to operate at the top of our education, the top of our licenses. So clinical services are my jam. So I'm excited to get to talk to you today about, what that looks like in the future.
Okay, so you threw out a buzzword. First line out of the gate. What is an MTM consultant? Because I like to think that there's going to be a variety of people that stumble across this podcast, from hopefully, some of those rock star pharmacists out there to maybe people who are still in pharmacy school and considering what paths are out there. What does an MTM consultant actually do?
That's a great question, because I didn't know either until I sort of accidentally became one. So after I graduated, I was working as a clinical hospital pharmacist for a small rural hospital here in my hometown. And because of budget cuts, hospital reimbursements are suffering just like everyone else is that's dealing with reimbursements and insurance. And because of budget cuts, they just couldn't afford to keep me on as a full-time employee any longer. So there were just two full-time pharmacists, myself and the director, that had been there for like 17 years at the time. And so they had to cut all my benefits and cut me back to PRN. Unfortunately, this was April 2014, and I was 6 months pregnant with my daughter, Avon. So that was really one of those moments that I was like, what am I going to do? This is not a great time to be out looking for another job. 6 months pregnant, I was planning on taking a 3-month maternity leave. Just completely turned my world upside down.
Sure.
And luckily for me, I had been working for some independent owners, and they were good friends of mine, and whenever I had texted them and just told them what happened, they were like, "We will give you all the hours that you need to get you through, the rest of your pregnancy and delivery and maternity leave." So I'm so blessed, and my heart has really always been in independent community pharmacy, but that, the way that they just really supported me and helped me through that time was, it was amazing to be able to give me that space. And then after I had my daughter and was kind of, ready to figure out what I'm going to do with the rest of my life, they were like, "Hey, Blair, you are a clinical hospital pharmacist. Now we've got you working in independent, and we've got this thing called an MTM program that we're going to have to start doing. They're going to be looking at adherence and our star ratings, and we're going to get graded on whether or not we're, completing these services." And I, like many other pharmacists, had never even done an MTM before. And it was so scary to me to think about, well, I'm going to charge an insurance for a clinical service. And that was like a whole new experience for me, that at the time I was was really kind of concerned about, because I had never charged, or I had never sat with a patient and been able to work through a comprehensive medication review. But after I did, I had a mentor walk me through my first couple cases and kind of show me the ropes. And after I did, I just absolutely fell in love with it. I thought, this is what I want to do. This is what independent community pharmacy should be all about. It should be all about helping the patient, working with them one-on-one. Like those first few patients that I worked with, I just really got to know them on such a, more deep level, even though they had been patients of ours for, had been working for a year. But really hearing about their struggles, it was, it was the turning point for me. And I thought, I don't know how I'm going to do this, but this is what I want to do. I want to do more of this. So I started reaching out to some other independents in Northeast Arkansas and Southeast Missouri. So I'm licensed in Arkansas and Missouri, and started reaching out and just asking owners, hey, do you need help with your MTM services? And some of them said, we don't even do MTM. Sure, you can, help us get set up.
At that same time period, I was an installer, and I was going to pharmacies, and there were these new buzzwords that were, not necessarily something most pharmacies were thinking about at the moment, when they're like 5-star. Okay. Outcomes, I guess I need to sign up for that. So yeah, I could definitely see where those early adapters are those, hey, let's get out there and share that experience, because it's a big shift.
Yes, absolutely. And they were, they were just like me. They were like, oh, well, I don't know if I can do clinical services. I don't know if I have time. Don't know how it fits in the workflow. Like, these are all things that we had to figure out really the hard way. But, now fast forward, 6 or 7 years, and with the COVID pandemic, we're seeing clinical services, point of care testing services, immunization services. I mean, people across the country are doing these vaccine pods, immunizing 300-400 people, in a weekend. And like, this, I think, has been, such a great opportunity for pharmacists to really flex their clinical muscles and show how we can make an impact on the greater community population health.
Yeah, it's been, it seems like this comes up in every every conversation, not just every podcast, but like, it's hard not to talk about, because it is such a big elephant in the room. But it's been neat to see that silver lining of how pharmacists could step up and really be noticed for their role, and how they can affect healthcare, and those, those big differences they can make in their community. And to see so many of those pharmacists out there, like, figuring it out, because it's kind of been the Wild West with this COVID immunization process from, day one, really. But it's been neat to see the pharmacists who are out on that front line to secure, that super cold storage, and, get signed up with the correct agencies to be able to get the immunization, and then it's been wild.
Yeah. And even, I remember last year at the beginning of the pandemic, my husband and I were in Cairo, Egypt, when the pandemic broke out. And I was speaking at the Arab International Pharmacy Conference in Cairo. We flew down to Luxor. We did the Valley of the Kings, was enjoying Egypt. But at that time, this was like March 6th, around then in 2020. And the only channel on TV that was in English was the BBC. So we had been watching the BBC, and Italy was shutting down.
Oh, gosh, yeah.
The only places that were open was pharmacies and grocery stores was pretty much it. And we were starting to get nervous. Like, are we going to get stuck in Egypt with, I was pregnant again with our third child, and our other 2 kids were at home with my mom and my husband's mom. And we were really thinking, what's going to happen? But I remember at the beginning of the pandemic just being so proud that that pharmacies were really being recognized as such an essential part of daily life that even during the beginning of the pandemic, when everything was shut down, pharmacists were still there to hold the front lines. And, that's something that I'm going to continue to tell that story for the rest of my life until pharmacists get the recognition and get the provider status that they deserve.
Yeah. So going back towards the MTM area, it really seems like that was like a shift in thinking of somebody outside the pharmacy walls recognizing, hey, here's where all the savings are. This is where the prevention lies. This is where the boots meet the ground, and we need to incentivize this. We need to, use this tool better. And so, when you first see these other entities, like that's got to be really encouraging for the profession to be like, yes, we told you, like we've been trained on this. This is what we're passionate about. This is what we've been doing for years and not getting paid for. So it's been neat to see that grow into like the documentation that we have now, where we have new standards coming out for, e-care plans, where it's really quantifying that scope of work. So like, how do you see that ability to quantify your efforts and document like what you've done and how it's had those positive effects? Like, where do you see that kind of pushing pharmacists to in the next, 5 years or 2 years?
Yeah, so there's 3 predictions that I have for the next 10 years or so. One is that really pharmacists are going to come out on the forefront of preventative services. I see functional medicine, integrative medicine, this shift from, being 100% reliant on modern medicine for our preventative services to this holistic, that's been on the fringe, the acupuncture and the nutrition and some of the stuff that we've seen in Eastern medicine for a long time. So I'm actually working on my master's in Ayurvedic medicine right now because I see there's so much opportunity that we can remove some of the obstacles and help our bodies heal themselves. Mm-hmm. So that's my first prediction, is really around pharmacists becoming the go-to source for preventative health. The second would be less reliance on dispensing for revenue. So with the, shifting to the clinical services, the e-care plans, these opportunities for billing in other ways, I think that our business model will become more diversified, which I see as a good thing. And then the third big shift that I see happening in the next 10 years is pharmacists being embedded in ambulatory care clinics. So working with doctors, just like, my mom's a nurse practitioner. So I remember this was probably almost 20 years ago now, and she was going through her master's program, and she cannot type on a computer at all. So I was in high school typing up her master's program notes and all of her essays because she would just write them on her, notebook paper, and then she would like make me type them up for her because I could type so much faster than her. And so 20 years ago, no one had heard of a nurse practitioner in a physician's office. No one had heard of a physician's assistant. The next 10 years, my hope is that, and I do think that it will happen, because I talk to physicians and clinics all the time who are asking me, where do I find these clinical pharmacists that can help us with our quality metrics? We had kind of touched on adherence and star ratings. When you start digging into the quality metrics that the physician's office has to meet, CMS passed new legislation in 2017 called MACRA. And that act was basically creating quality benchmarks for ambulatory care clinics. So there's 2 tracks that they could do. in this quality payment program. And it's pretty much all based on patient outcomes and performance. So if their patients are outside of their A1C goal, these physicians are going to get dinged, come 2 years down the line when CMS starts looking at their data and they're saying, I mean, you've been seeing this patient for, 4 years and their A1C is still outside of where we want it to be.
Right.
What gives? And I think having the pharmacist there to step in and ask some different questions of the patient and, be able to spend more time with them talking about, is it lack of adherence, or is it, is it diet? Is it exercise? Is it other medications interacting and playing a role with this? There's so many opportunities, I think, because pharmacists we're trained in a completely different way. I like to say that physicians are really trained to diagnose, and pharmacists are trained to manage these chronic conditions. And so some of my clients now are working with collaborative physicians in these collaborative business agreements, collaborative practice agreements, to be able to offer chronic care and remote physiologic monitoring services remotely for their local collaborative physicians. And it's been a win-win, because pharmacists, even though we don't have provider status, we have these opportunities to make an impact on patient outcome, which translates to hundreds of thousands of dollars for the clinic down the line when you look at quality benchmarks. So
it's like the Zig Ziglar quote where you can have everything you want in life if you help other people get what they want.
Exactly.
And I don't think he was talking about healthcare or medicine, but, I think for the pharmacy, their value really lies and that exactly that win-win scenario. But I feel like the pharmacists have been somewhat, like in a silo. They're doing these amazing things and not communicating that or passing that with the other members of the equation. So, how do you increase that communication? How do you get that buy-in from a physician where it's like, hey, you're trying to reach these goals, you're getting pinged on this. That's exactly what I can help with. How do you start that collaboration?
Yeah, so this was really, what we were going to focus on for this, converting these free consultations into clients. Whether your potential client is a patient who may be interested in your functional medicine program, or a physician, a local physician that you want to go talk to about a collaborative, remote patient monitoring program. But getting comfortable with selling, and just by knowing a few of the frameworks that we talk about for selling can really help you to not necessarily persuade, but just to help other people get what they want. And you can also, be able to grow your revenue and grow your clinical services and really generate demand for pharmacist-led services in this way, just by knowing how to talk to people about their needs. So there's 4 A's that we teach in the Pharmapreneur Academy, which is, you start with asking. You just ask, what are you struggling with? What kind of results are you looking to get? If you're talking with a patient, what are your health goals? If you're talking with a physician, what quality metrics are you reporting on this year? Just trying to figure out their pain points, and then, assessing, is there a way I can maybe help this person before agreeing upon what the service could actually look like, what that program would actually look like, and then finally accepting and making an offer for that arrangement. So I think most of the time we think selling, because it's such a subtle art, We think selling is going in and handing someone a flyer and waiting for them to call us back, or like doing your pitch and expecting to get, your phone blowing up. And it's really more about relationship building and creating a customized program for the clients you're working with so that they can feel like their needs are priority number one.
So do you have like any tips for like preparing that conversation? So, if I have a fantastic pharmacy software in my pharmacy that allows me to run, great reports, is that something that you would do ahead of time, is maybe look at that prescriber in your system, see what kind of medication, see what kind of, are there trends with therapeutic classes or disease states that you could really kind of bring those tailored solutions on step one, or do you kind of put that later in line?
Yeah, so that might be like a great just icebreaker kind of question for that position, to call them and say, "Hey, I've got this fantastic pharmacy software. I can run a report on pretty much anything that you could possibly want. What are some challenges that you guys are dealing with?" It may not be with managing diabetic patients. Maybe it's it's with COPD patients, and you can really isolate and run reports for people who would be a good fit. So, you can imagine if you could run a report that shows a physician what patients they have, what medications they're on, that they're outside of goal, but then you could offer that physician a collaborative opportunity to where your pharmacy is helping them manage this patient's care, get their COPD or diabetes or whatever it is under control, and they can get paid additionally for this service. That's what chronic care management is. And it's a 20-minute non-face-to-face clinical service once a month. You get reimbursed. I think average national reimbursement is around $42. It has to be billed through the physician's MPI, and it has to be consented by the patient. So they have to sign consent that they're interested in this service. But when you think about it, if you have a MedSync program, you probably already are calling these people and spending 20 minutes a month working on their medicines. So to me, that it's just a win-win situation that, hey, pharmacists are already doing this. And then you get a collaborative provider on board, and you can get this patient the outcomes that they're interested in, by asking what their quality metrics are. You create a plan, a customized calendar that your pharmacy, even technicians can be involved in this, calling the patient, just getting set up for prior authorizations and refills. All of that counts as dedicated clinical staff time. And being able to capture that time and record it and document it in an e-care plan, you just do that, send that e-care plan packet to the provider's office. They put it in their chart, sign off on it. That goes to billing, and then, they get reimbursed for something that essentially they didn't even really have to have a hand in, just
Right.
overseeing the program. So CMS, they call this general supervision. So it means a subcontracted pharmacist, clinical pharmacist, or really subcontracted clinical staff member, could be anyone. But pharmacists obviously are my choice for this type of program, to be able to capture the time that they're spending working on that patient's care, and to be able to get reimbursed for it. It's a huge opportunity for pharmacists. And then you throw in the remote physiologic monitoring, where we can look at blood glucose digitally uploaded in real time. We can look at digital weight. I mean, you can monitor people's, if they've got more than 2+ weight gain each day, you get an alert, you see that in your software. I mean, there's so many opportunities for pharmacists to really get creative and start thinking out of the box about like what you could do with a collaborative physician.
Okay, so I hope I didn't roll too many of the other A's into that answer, because you said there were 4 A's and I think we made it through one. So what's the what's the
No,
next A?
no. That was so ask would be number one, and then assess would be number two, and then agree would be number three, and then accept would be number four. So we did kind of do
Okay,
all
good.
of them, asking about their pain points, assessing how you could potentially work with them, agreeing on something that would be mutually beneficial to you both and to your patients, and then finally accepting and putting together a legal document that solidifies the partnership and makes sure there's no gray areas in whose scope of practice ends where, and what a pharmacist can legally do in that situation.
Nice. So one of the things that you mentioned earlier was kind of how the roles have shifted in a physician's office. And there are positions there that you mentioned weren't there before. Do you see like a shift in the roles within a pharmacy? I know the role of a technician varies night and day from one pharmacy to another. It's such a broad scope of responsibility. And then we see, there are pharmacists out there like, Amina, I've seen her speak a couple times on how to better utilize her technicians. I mean, you have to wonder sometime if maybe there's an opportunity there for like a more advanced role between the technician and the pharmacist.
Yeah, absolutely. So I think Amina has actually employed some nurses, I believe, as well. And just thinking outside the box, she does such a great job in really thinking about how to put her team members in the best possible places for not only their success, but the overall success as a business. I mean, their model is just fantastic in terms of leadership. And what I'm seeing now with more tech programs and even techs being able to administer vaccinations, what I see the opportunity coming up there is for pharmacists to finally be able to have the time to do more clinical services. So, for example, I just helped. There's a regional chain in the Michigan area, and we were putting together a drug-induced nutrient depletion program for them. And just starting out very simply, they were like, well, where do we even begin? Like, begin at the counseling window. A patient comes up, you're counseling them on, maybe it's a statin, maybe it's a birth control. You're counseling them on this, asking them about what types of vitamins and supplements they're taking. You have their medication list, but a lot of times we don't think about entering vitamins and supplements onto their patient profile. But, really, if someone's on, on statin, they need to be on CoQ10, or if they're on birth control, they need to be on a B complex vitamin. And so just being able to get comfortable, just creating even a sales script that your front end support staff members can use. The register people, hey, I see you're taking a statin. Do you need any more CoQ10? Are you out? I'd be happy to run and get you or show you exactly what our pharmacist recommends. But if you want to have, a more in-depth conversation with the pharmacist, we can set you up with an in-person consult or even a Zoom consult now, I guess.
We actually just had a new feature come out this week that allows you to set the target point as the point of sale on like a specific care action. So like a CoQ10 nutrient depletion situation, hey, the best place to talk about that with the patient is when you're with the patient. So it just makes sense to Yeah, take advantage of that, while they're right there at the counter. But then also, um, it comes back to that win-win situation where you're providing a service that has great value to that patient. You're going to help that patient feel better. And yeah, it's going to help your bottom line. And that's not, uh, the idea of providing the best healthcare possible and running the strongest business possible are not mutually exclusive. So
Exactly. Yeah. I mean, I just using an example. So we do like the ketogenic diet, intermittent fasting stuff. And one of my friends was asking me about starting it. And so I guess she had started and was having a lot of muscle aches. And I was like, well, you do know that if you're going to be on one of these pretty strict diets, that you need to have a very high quality vitamin supplement that you're taking. And she was like, nobody's ever told me that. And I was like, well, I think it's a good idea. That's probably what's causing some of your muscle issues, and you're probably losing a lot of water. And she was like, but I can't take vitamins. They're too large. I can't swallow them. I'm like, well, the pharmacy down the street has some really good high quality gummy vitamins. Can you eat a vitamin gummy? And even just something as simple as that, like she had never even considered that there were other options, or that if you're going to be on a diet that you needed to be supplementing with, high quality vitamin supplements. So it was something that was causing her an issue, and probably something that was affecting the outcomes of her weight loss. But just that small shift and that little conversation created, some trust there, because just some simple tips that I gave her that wasn't anything earth shattering or like that I needed a residency to figure out. Just, those little changes that we can make, those little baby steps we can help our patients do, will lead them to that, be the healthiest versions of themselves that they can be. So if you think about it like that, you're not thinking about it from a terms that like selling is bad. Selling only feels bad. It only feels yucky if you're trying to sell something to someone that they don't want it. So that's why we teach the 4 A's, to start with a question of like, what are you looking for? What are you struggling with? What have you tried before? 3 very simple questions that you can use in your counseling or in any interaction that you have. And then, if their answer seems to be something that they might be interested, you can offer to have them make an appointment with you to come in and sit down and have that, free consult, or even a very low cost consult, to figure out, that one little piece that can help them to kind of start their journey to the next step. So, I even compare using vitamins and supplements and drug-induced nutrient depletion stuff to the gateway drug of, really changing your nutrition, changing your exercise, changing your health. One of the things that I really see coming from this pandemic is an increase in mental health issues, as well as low-grade chronic stress causing autoimmune type issues. So, I think all of us can definitely feel that there's been some low-grade chronic stress happening throughout the past 12
sure,
months.
sure.
and
Yeah,
and really, there's not anything you can take for low-grade chronic stress. So, things like meditation, walking, exercise, in addition to if we do need to put the patient on, on something like an antidepressant, or even something like a GABA or glutamate supplement that they can use to help them calm down at night, or a CBD tincture for helping with anxiety and sleep at bedtime. There's so many options, and pharmacists, in my mind, which I am biased, but pharmacists are really the best person to ask, because we embrace those things. We embrace the herbal the, more allopathic and holistic methods, being able to combine them, because I think we understand the body's biochemistry and physiology at a cellular level, that we can say, yes, that could be a good option for you, or no, that might be something you want to stay away from.
Yeah, and mental health especially. I think there's a stigma that, as a patient, I don't know that every patient is going to be as comfortable reaching out to like a mental health professional, or, even having a conversation like that with their doctor that they see, every so often. Uh, Whereas, a pharmacist that says, "How you feeling this month?" You may just open a floodgate there and have a much different outcome. And like you said, with just over the counter items, it doesn't have to be a prescription. Which again, I think there's definitely a stigma between like, going to pick up that first prescription of Prozac, or there's definitely a a hurdle there that again, a lot of times doesn't need to be taken anyways. The pharmacist may have other creative solutions for that.
Yeah,
So,
absolutely. And I think patients are looking for that now. They're really looking for non-pharmacological interventions. Um, People ask me all the time about my meditation practice and what I'm taking, like as far as CBD or vitamins and supplements, the way I eat, the way I exercise. People are constantly asking me those things because I am pretty open and sharing about that stuff on my social media. And that's something that I think pharmacists could also leverage and start thinking about, like where are the opportunities that we can talk more about what's working for us as a person. Our
mhm.
patients are just people, we are just people, doctors are just people. And talking about, your what's working for you, what you like and what you don't like. I mean, for me, when I kind of started this genetic consulting business just to see how it would go back in 2018, because I tested myself. I did a nutrigenomic test panel, and I found out that I can't methylate folic acid or B12. So if I was taking a B vitamin, which I was when I was pregnant with my son and my son was actually born with a pretty deep sacral dimple that was almost an open neural tube. And I thought, oh, that's so weird. Like I took my prenatal vitamins, I took my folic acid religiously, but then from, my background in pharmacy, I knew that some people couldn't methylate folic acid. And when I did that test, I really saw that I wasn't getting any of the folic acid or any of the B12 that I needed. So I talked about that on my social media, and then people just started really asking me for help with looking at their genetic test results, and even stuff that I don't do, like the 23andMe ancestry DNA stuff. Like I don't really know much about that, but I mean, I can look at the health stuff, because what was really interesting to me was when I did one of those health DNA profiles, it showed that I had increased risk of Alzheimer's, which my paternal grandmother died from, and increased risk of Parkinson's disease, which my maternal grandmother actually has. And so
Hmm.
doing some research, because I got to get to the bottom of this, figure out what's going on, actually not being able to methylate folic acid and B12 causes a rise in homocysteine in the blood. And homocysteine it is correlated with inflammation at the cellular level, specifically the heart level. So it causes cardiovascular disease and neurological disease. So when I found that out, and I think there might be a chance I can avoid getting Alzheimer's and Parkinson's when I'm in my 70s, I'm going to do it. And so I talk about that stuff a lot. And it's, for me, patients are now coming to me, and it's generated demand. And I don't even offer this as a clinical service. I'm like, telling the local pharmacies, can you guys please put this service just so I can refer people to you? Because I don't have time to do this anymore.
Yeah, it's so funny how social media has kind of changed over, I don't know, the past few years. Like a Facebook page now, like I guess my first social media was MySpace, and that seemed like a very kind of like small, it was just you and your friends a little bit. I guess there are some influencers. We didn't call them that back then, um,
I
but
remember
it's
Tom.
interesting. Hey, Tom. Yeah. um, but it's interesting how like, I don't know, there seemed to be this thing in the 90s and in the 80s where like if you were a business owner, you wanted to look bigger than you are. You wanted to look corporate because that meant that you were um, established, that you were trustworthy, that you were the real deal. And it's funny, it's with social media, it's very much kind of pushed that backwards, I think, where big corporations try to act like they're small. Um, and they can't win at that when there's a few pharmacists that I have on my Facebook that I see them post videos from in their pharmacy talking about, whatever's on their mind. And it's always like really helpful, like recommendations with, um, different over the counter supplements or just, updates on, hey, here's what's going on with COVID and in our area. And it's neat to take advantage of that personal connection.
What I really see, and I'm a millennial, so what I really see the future of pharmacy practice being is in convenience and in customization, because people want personalized services for them. They want personalized recommendations and customized programs to help them with their individual situations. And then convenience, the more things that you can do, adherence packaging and delivery services. And, we're really going to have to be able to do that to compete with the Amazons and, those types of people that are getting into the pharmacy space, because I think that level of customization helps differentiate, but you still need to be able to meet the minimum bar for convenience. And being able to do that, I think when I see pharmacies do that, some of my clients, they're the ones that are just running away with these opportunities because they are getting contacted by the providers. They are getting contacted by patients. They're the ones that are really, what I say, thinking like a pharmapreneur. They're making themselves the person to call, the pharmacist to call in their area. And that's generating demand so that they're not feeling like they constantly have to push a boulder up a hill when it comes to marketing. It really starts flowing in a much more organic way.
Yeah. So we're winding down on time, but I definitely want to make sure that we talk a little bit about the Pharmapreneur Academy and just make sure people know how to get in touch with you, because you do offer a lot of services that are going to help these pharmacies kind of get the ball rolling with some of these things we talked about, right?
Yeah, absolutely. We have different tiers for people. The beginner's business blueprint is for someone who's like I was in 2014, never done an MTM, never worked with a physician, never done a genetic test or anything. It gives you a framework for, do I want to work in a physician's office? Do I want to offer these services in my pharmacy? Or do I want to focus primarily on cash paying services? And there is some overlap there, but it just helps you to kind of put your blinders on, because it can be overwhelming. I mean, I don't know how many different types of clinical services we've talked on this call, but I think I've written down a list of about 40 different ones, at some point. And so the opportunities are really great for pharmacists who have the infrastructure and are really ready to step into integrated clinical services into their workflow. So the beginner's business blueprint really helps to build that foundation. Then we have the advanced learning lessons within the Pharmapreneur Academy that teaches you. So I used a lot of technical language when I was talking about MACRA and MIPS and the quality payment program and chronic care management and remote patient monitoring. We explain those if you've never heard those words before, we explain those in excruciatingly technical details so that you can understand and be able to talk about it with confidence and not say, well, there's this thing I've heard before, maybe we could do this. So it gives you the resources that you need without having to sit through, 15 hours worth of webinars. It really is meant for you to just go and watch a little chunk when you need it. And I compare it to like the Netflix of pharmacy. You just go watch a little piece here, watch a little piece there, take what you need, put it all together.
You call it like Netflix and Phil?
Yes. Oh, I like it. I like it. We could do like a whole logo. That's perfect. And that, I think that level of support, because we also have forums within the community. So if you do get stuck, you can ask me, you can ask Tara. She works in a physician's office in South Florida. You can ask Thea. She does remote patient monitoring for a collaborative physician in Pennsylvania. You can ask Kimber or Jerika or Jared. We're building out a whole community of consultants who are experts in these various clinical services. And what's exciting and what we have coming up is our annual Elevate Pharmacy Summit. So that's 2 days where I basically will walk you through our entire system for creating these clinical services and creating demand for your clinical services, because that's a lot of times the most difficult part is you have the clinical training that you need. Pharmacists, I think we are so underutilized, but we have so much knowledge that we can offer to our patients. We just need to figure out how to package it kind of in a new way. And that's what the Elevate Pharmacy Summit, the focus is of it. So it's a 2-day event, April 9th and 10th. That's a Friday and a Saturday coming up here in about 3.5 weeks. And the theme is really to, think about the impact that you want to have on your community and figure out how to put that together so that you are generating demand for these services and positioning them in a way that makes patients, payers, and providers come to you and want to work with you.
And you always have a really all-star lineup on that too. I always enjoy going to watch those and look at your lineup and see who you have speaking, because it's always like, if I joke a lot and I say, like, if we had pharmacist baseball cards, like those would be the ones you keep in the case, man. Those are always just really, really great to watch. So I know it's going to be a great event. Looking forward to seeing that. Looking forward to getting out and going to live events. And right now, the virtual events are, I feel like you've probably been doing the virtual events for a little bit longer than a lot of the other folks out there. So yeah, I feel like you've gotten it down pretty well, and those are always very enjoyable, so very informative as well. So I'm gonna let you get back to work. Thank you so much for joining us, and I'll see you here hopefully before too long. We'll have you come back.
Yes, absolutely. I get to see everyone in person and present on the PioneerRx stage again. I'm so looking forward to it. So thank you for having me on the podcast. It's been fun.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.